Muhammad Ali, the boxing legend, he was afflicted by Parkinson disease, one of the dreaded diseases. In his later years, he was totally unlike what he was in his real life. 32 years of battle after being 3 times world champion in the heavyweight. He was fast. He would float like a butterfly and sting like a bee. His fights were among the greatest. Off the field also, he was an activist. He was against racism. And on the field, on the arena, there was nobody who could touch him. One of the greatest boxing legends of all times. His legendary battle with George Foreman. In the 5th round, a knockout. The great legend, after 32 years of battle with Parkinson disease, was a total wreck. And he died last year, mourned by everyone in the world. Today I talk about Parkinson disease and Parkinsonism.
Hello friends, good morning, a warm welcome to you. I am Dr. Raj Shekhar. I am a neurologist by profession and I love giving training videos, and this is one of them. I was very excited when somebody asked this question, which is why I actually decided to do this video. This was a question raised in a forum on the internet. Somebody said, that my mother has been diagnosed and has been told that you have Parkinsonism syndrome or Parkinsonian syndrome, you don't have Parkinson disease. So what does it really mean? It's a very important question, something that I would love to answer. So I hope what I share here will help you to get a better understanding, not only of Parkinson disease, but also of Parkinsonism. Now, Parkinson disease or idiopathic Parkinson disease, as it was originally, or it is actually called. Okay, it was originally described by Sir James Parkinson way back in the 1880s. His description was so accurate, so perfect that till date, we've not been able to improve it. It's so good. Now, he described 3 features, which are called 3 cardinal features of Parkinson disease. And I'll give it to you and I'll explain a little bit. Number 1 is bradykinesia, which means a specific form of slowness of motor activity. So, bradykinesia. This clip demonstrates typical bradykinesia. The patient is not able to keep up pace with the examiner's fingers. When he asks him to do movements like a piano playing, he is not able to do it. Rapid alternating movements at the wrist, you can see that he is very slow compared to the examiner, and this is very typical of bradykinesia. Number 2 is rigidity, a specific kind of stiffness of the muscles. So, rigidity. In this video, the examiner tries to turn the head of the patient from side to side, and you can very clearly see the very marked degree of axial rigidity. And number 3 is tremor. Now, tremor is a rhythmic movement of the limb, shaking kind of movement around a certain joint. That's a tremor. And in Parkinsonian, you have a very specific kind of tremor, which is called a rest tremor. That means with activity, the tremor actually goes down, which is why Parkinson disease patients are able to perform most of their actions. This clip demonstrates typical tremor, resting tremor in Parkinson disease lady in the lower limb and now in the upper limb. Right. So, bradykinesia, rigidity and tremor. These are the 3 cardinal features. Along with it, subsequently it was also found that they also develop a certain kind of postural instability, which means that they have a tendency to fall down. They also have other features like a typical Parkinsonian gait, their handwriting changes, their voice volume goes down, many changes. Parkinson disease is an entire set of features. But I'll tell you one thing, there are few things which are very typical of the idiopathic Parkinson disease. Now, let me describe to you the diagnostic features which are very important, because this is important for me to share when I talk about Parkinsonism. Now, what we use, one of the things or the criteria we use is called the UK Parkinson Disease Rating Scale, UK PDRS. Now, as per the UK PDRS, I will just state a few of them. There are huge number of them, but the more important ones. Okay. So number one is that at the starting point, at the beginning, Parkinson disease usually affects one side of the body. Number two, even when it becomes more severe, as it progresses, it remains more prominent on one side, on the side where it was initially present. So two very important points. Number three, the features, the conditions, the symptoms of Parkinson's disease respond very well to levodopa. Very important. Sometimes we use it as a diagnostic test also. If there is no good response, okay, almost 80% to 100% symptoms are gone as soon as the dose is taken, then we question the diagnosis. Number 4 point, the response to levodopa continues late into the disease. The patient may be severely disabled, but still continues to take levodopa because it produces significant relief. And number 5 point I wanted to make here is that only in Parkinson disease, levodopa produces a very classical abnormal movement disorder. They have an excessive movement which is called levodopa-induced dyskinesia. This is very typical, and presence of that confirms that this is Parkinson disease.
This is actually a clip that I took out from Oprah Winfrey's show, in which Michael J. Fox actually made an appearance. You can clearly see that he had severe Parkinson disease. He's actually showing classical signs of excessive motor movement, which we call levodopa-induced dyskinesia. You can see the excessive movements in the face and the head. Compare this to 25 years before this, when he was a young man in the 1991, when he had just finished the movie Back to the Future and other movies, when he was quite normal. Compare the position of his body, his head, his limb movement, head movement, to what it was 25 years later in 2008, when he had these excessive movements, typical dyskinesia.
Now, these are some of the features. I have not given you an exhaustive list. Now, based on this, we label somebody Parkinson disease. Okay, Parkinson disease patients also have a very typical gait. Okay, it is called Parkinsonian gait, and here is a video of that.
This is the classical gait of a Parkinson disease patient with stooped posture, slow movements, slow turning of the body, and almost no arm swing.
So the question is, what is Parkinsonism, right? Now, Parkinsonism is a syndrome. A syndrome is a constellation of symptoms which happen together more often than, by chance, but we cannot attribute it to a one condition or disorder, and then we call it a syndrome. Right? So Parkinsonian symptoms can present like that. That means somebody may have those three features I mentioned: bradykinesia, slowness, rigidity, stiffness, and tremor. 2 features, 3 features, 1 feature, or something like that, which appears to be somewhat like Parkinson disease. But at the beginning stage, we're not able to make sure that this is Parkinson disease or not. We use UK PDRS criteria, but sometimes we are not able to conclude. Sometimes we have a predisposing factor, like somebody is on a medication which is known to produce Parkinsonian symptoms. So we can actually immediately start thinking, okay, actually maybe this is not Parkinson disease, this may be drug-induced Parkinsonism. That is a Parkinsonian syndrome. There are other conditions like Wilson disease, hepatolenticular degeneration, which is non-Wilsonian type, progressive supranuclear palsy, and so on. they all present with a condition which mimics Parkinson disease. Now, what is the importance? For example, let me take progressive supranuclear palsy, or let me call it PSP. Steele-Richardson-Olszewski syndrome, which is a tough name for me, but that's the name eponymic classification. But what it basically means, PSP means, is that initially it will look similar to Parkinson disease. It may not be easy to differentiate. Okay, down the line, the other features start coming up. Then it becomes clear that this is not actually Parkinson disease. This is actually PSP. That's one thing. Number two, the condition is much worse in terms of prognosis. People with PSP, by 6-7 years, they become severely disabled, and survival beyond 8-9 years is very unusual. This is what is a literature. So what are the differences? Okay, now classical example of PSP. Okay, number one, the rigidity which is present is usually axial, not appendicular, which means appendicular means in the limbs, axial means in the central part of the body. So in PSP it tends to be more like that. Number two, there is significant abnormality problem with the ocular movements, extraocular movements, especially vertical upgaze, which is very typical. Okay, and they have a great degree of postural instability right from the beginning. Almost within the first 6 months they start falling. So if somebody comes and says, I have Parkinson's, but I fell down many times, 5 times, 10 times I have fallen down, I start seriously questioning the diagnosis. I think it might be PSP, right? So if they have vertical upgaze palsy, if they are moving N graph, right? Which means that instead of turning the head, they are turning the whole body. When they have to look around, they look like that. They cannot turn their eyes up, so they turn the whole body like that. This is very typical of PSP. Their voice changes, their handwriting changes, they don't have much tremor. Okay, they tend to fall frequently, they have bladder disturbances, and they have a very, very poor prognosis. Very rapidly progressive, they develop dementia very early. They don't respond to levodopa so well. Still, it is prescribed, it is given to them. They do have a certain amount of response, but by and large, they don't have as much as in Parkinson's disease. So this is what I wanted to share, the difference between Parkinson's disease and Parkinsonism, Parkinsonian syndrome. And I highlighted a few features of PSP. This is for use for people who want to study neurology or medicine, or who want to get more education in the medical field. This was my intent. Thank you so much. Bye.